Hello, everyone. I'm John Gigliello, certified financial planner with the Albany Financial Group, and welcome to my podcast, Invest in Knowledge, a podcast about all things financial. After a life-altering health issue at age 39, my calling in life became clear: to share my knowledge of personal finance with people who are ready to make smart decisions, responsible choices with their money. You see, it's only through education, action, and accountability that you can build the confidence and security that you need to live a satisfying life. Today, we have a special treat in store. We are lucky enough to have an industry expert with us to help us better understand the complex subject of Medicare. The timing of this episode is actually perfect. You see, today starts the annual coordinated election period, which allows current Medicare subscribers to make changes to the supplemental plans that they currently have in place. So what do you say that we dive right in? Our guest speaker today is Chris Amorosi. Chris is a licensed New York State sales representative and has been giving folks guidance on Medicare plans for over 15 years. He has held sales and management positions with CDPHP, Fidelis, MVP, and United Healthcare. He is certified to present competing Medicare plans from Aetna, Highmark Blue Shield, CDPHP, Humana, and United Healthcare. Chris, welcome to the podcast.
Hi, John. Good morning, and thank you. I appreciate you for inviting me today, and hopefully we can make some sense of this crazy world called Medicare. So,
okay,
we're in for a good ride here.
Yeah, that would be great if you could do that for us. I know a lot of people very interested, very complex topic, and I get tons of questions on this all the time. So I know you're very busy. It's a real busy time of year for you. So again, we appreciate you carving out some time to be here today.
Well, thank you.
So Chris, what we're going to do, and just to inform our listeners and viewers, the basis for our conversation today is going to be based on a Wall Street Journal article. And I have that right in front of me here. The author is, hopefully I pronounce this correctly, Amitabh Chandra. It was written on August 15th of this year. And the article is entitled, "The 5 Biggest Mistakes People Make When Picking a Medicare Plan." All right. So we're going to go through each one of these mistakes or observations in his mind. And I'd like you to, again, being the industry expert on this, I would just like you to comment, to expand upon, or even disagree with what the author is saying here, because again, you're in the trenches. You see this stuff every day. So that's what we're looking for. I think that's what the listeners and viewers are really want to get the behind baseball kind of look at what's going on behind the curtain, so to speak.
Sure.
So the very first mistake that the author mentions is that it's very easy to underestimate the cost of traditional Medicare, underestimating the costs of traditional Medicare. So I think Chris, when he uses that term traditional Medicare, he's talking about the old Medicare, how it's been since inception, pretty much like parts A and B that everybody is familiar with. Not necessarily, right? Not necessarily the C plan or the prescription drug, or maybe the Part D is in there. But is that correct that the traditional, did I get that right?
Yeah, when they mention traditional Medicare, they're talking specifically about Part A and Part B. And not to get too deep into the weeds with this, but and I'm sure everyone understands this. Part A is for all your inpatient hospitalizations, skilled nursing facility costs, and then your Part B are for your labs and your outpatient and your everyday doctor visits. So you put those two together, and that is considered traditional Medicare.
Okay. All right. Good. Thanks for that clarity. And I wouldn't just assume that everybody knows stuff about this because again, it's so complex. So yeah, a lot of people don't. So the author mentions as one of the possible, again, issues here, mistakes, underestimating this cost. He also states that the big appeal with traditional Medicare is the fact that you can visit any hospital or any doctor without a referral or without some type of prior authorization for services. So would you agree that's one of the big highlights of the traditional Medicare system?
It is, because a lot of people enjoy that sense of freedom. They can go anywhere they want, anytime they want. They don't have to have a particular doctor. Oh, is my doctor in network? Is my doctor, does he accept this plan?
Right.
But the thing that people have to take into consideration is that you really don't need to worry about it, but you need to have this in the back of your mind. Approximately 1% of the doctors nationally or nationwide don't participate in Medicare.
Mm.
So, I mean, they are far and few in between. And the chances are pretty good that any doctor that any individual is seeing right now or wants to see is accepting Medicare. But what I would do just to be on the safe side is just always ask, does this practice accept Medicare? And if you want to just stay with traditional Medicare, that is the key to finding your doctors, is that they accept Medicare.
Excellent point. Excellent point. I can think of actually a personal story that is directly reflects what you just said. That when my dad passed away, and my mom came upstate to live with us. Uh, she was going through her second battle with breast cancer at the time. This was in the late 1990s, and we were checking out docs, and the one physician that we really liked did not accept Medicare, right? And I'm thinking, oh, this is just, she's got radiation treatments and chemotherapy. There's just no way that we could afford this out of pocket without some type of coverage, and just couldn't do it out of pocket. So I makes complete sense what you said.
Yeah, and I mean, and I don't want to get off topic or jump ahead, but that I think is one of the misconceptions. Um, is even with these Medicare Advantage plans, there's a lot of plans out there that you don't need referrals, and they have national networks. And so, and
Mhm.
I'm sure we'll get into this a little bit later, but I agree to a point with what she is saying, but
Mhm.
there's a lot of options out there other than that traditional Medicare option.
Okay. All right. Good to know. Chris, Part A premiums are often zero for those who have worked at least 10 years, right? But it looks like Part B carries premiums based on your income. So can you expand on that a little bit about those two parts and how that works?
Yeah, and this is a question that gets a little crazy,
Mhm.
because there's so many different guidelines and rules that people
Yeah.
have to be aware of. So
Mhm.
yeah, Part A premiums are traditionally zero, and as long as you have worked 10 years or 40 quarters. Um, it's automatically given to you. And
Mhm.
over my 30 years of doing this, I think I have come into maybe one or two situations where folks had to pay for their Part A. So in
Mhm.
that case, like for 2023, someone without Part A and had to purchase it on their own, they're looking at $506 a month just for the Part A premium.
Wow.
Um,
Mhm.
so for someone who maybe worked 6 years, then they would prorate that. But that's something where you
Mhm.
would call Medicare if you're in that situation, and they would walk you through and tell you exactly um,
Mhm.
how much it would cost. So for the Part B premiums right now, the monthly premium is $164.90. This past weekend, the 2024 Medicare increases just came out, and the Part B monthly premium has a 6% increase to it. So it's going to increase to $174.70. So for all these people who are happy that they got that 3.2% increase on their Social Security, Medicare Part B went up 6%.
Yeah.
So,
Right. A net
you know,
loss there. Right.
right. It's like climbing a grease pole. You're getting nowhere.
Sure. Okay. Good to know.
Yes. So back in 2007, I believe, and here comes my history. Was it President Bush, I believe, started the Medicare Modernization Act, and the government named this program the Income Related Monthly Adjustment Amount, or the acronym that we use in the business is called IRMA.
IRMA, right.
So based on your income, that's going to dictate what your Part B premium is going to be moving forward. So everything is based on a 2-year look back. So 2023, they're looking at 2021 income. So just to give you, just a couple figures. So if you were making as a single less than $97,000 a year, or as a married couple less than $194,000 a year, you would stay at that $164.90. But as a single, we'll just say you jumped up to $123,000 a year as a single, and a married couple greater than $246,000 a year, your Part B premium would jump up to $329.78. So based on that, that is one of the questions that if you are working with an agent or working with an individual or a company, and you know that you have a decent size retirement or an annual income, that's one of the first questions that you're going to have to ask about your Part B premium. The nice thing about it is the Medicare, the IRMA is always looked at every year. So, if you hit a windfall one year and next year you go back down to a regular income, it will be adjusted.
Okay. All right. That's good to know. Even with that 6% increase, Chris, that monthly premium, I mean, that still sounds like a pretty decent deal, given the fact that I've seen premiums for private insurance policies, and they can be astronomical. So it seems like a lot of folks complain about government healthcare and where that's all going, but it seems for that premium, that's not bad for the coverage you get.
Correct. But when you're doing financial planning for people, you have to take into consideration that that's an expense that they're going to have for the rest of their life. So, now, if you're talking about getting into a Medicare supplement plan, which are pretty expensive, now you're looking, now you add that 174 to a higher premium there, and now you're looking at some major dollars coming out of pocket.
Sure, without question. The last point in this mistake, again, the author points out, and I want to jump back to Part A for a second, Part A and hospitalizations. He points out that most hospital stays, with a few exceptions, they require a $1,600 deductible to be paid before coverage kicks in. So again, is that sounds correct, huh?
That's correct. Yeah. So no matter if you're in the hospital 1 day or 40 days, there's a $1,600 Medicare Part A deductible that is required by you to pay. Now, if you go over that 90 days, now you have that $1,600. And in addition to that, days 61 through 90 carry a $400 per day copay. Now, if you go beyond that 90 days, I mean, the average stay right now in the hospital is about two and a half days.
Okay.
So, but these scenarios here, you're looking at, a severe stroke or major heart attack or something really drastic. But
Right. Right.
um, so Medicare pays for 90 days. That is it. Then Medicare allows you to have what's called lifetime reserve days, and that's an additional 60 days. So if you are in the hospital beyond that 90th day, you are responsible for $800 per day up to 60 days.
Wow. Okay. So all of a sudden, not so free once you
That's
start
right.
hitting those limits.
Exactly.
Yeah. Okay. All right. Good to know. Thanks for that, explaining that. Let's jump up to the next mistake, mistake number 2 that the author points out. He states that underestimating the costs of Medicare Advantage plans can be a problem as well. So again, here's where we're kind of shifting from traditional Medicare, as we've seen it from the beginning days. Now we're starting to talk about that these Advantage plans, the supplemental parts of
Mhm.
insurance to the traditional. So the first area that he states that could be a problem is, and I've seen this myself and clients have told me that the premiums, they've done some homework and pricing out plans, Medicare Advantage plans, and we can call that Part C, right, Chris? Those
Correct.
Advantage plans are Part
Yep.
C.
Part
Okay,
C.
so I'm just going to call it Part C for now. And they tell me that when they price out some of these plans, they see a fair amount of them are zero premiums. And it's like, wow, zero premiums. How can I go wrong with that? But of course, that kind of begs the question, how do insurance companies do that? How can they offer zero premiums and still make a profit?
Yeah, and this is one of the ones where we can talk for 20 minutes, a half hour.
Sure.
So I'm just going to quickly summarize this. So in the simplest of terms, the government really would prefer private insurers to handle all of these Medicare claims.
Mm-hmm.
So instead of Medicare, the Medicare program itself, um, they farm it out to private insurance companies, saving the government resources and money.
Mm.
So that's one aspect of it. Now, the private insurers, how they save costs and how they can get down to those zero premium plans is they establish networks for their Medicare Advantage plans. From the networks, those networks help keep the expenses low because
Mm-hmm.
the contract will say if I go to Dr. Jones, and the insurance company says for every member that you see with Acme Insurance Company, we will pay you $40 as a reimbursement.
Mm-hmm.
Dr. Jones will then take the copay from that member, say it's a $35 copay, and they're in essence getting $75 for that visit. And the doctor's like, okay, I can survive with that. So from there, all of those networks, all of those contracts negotiated with providers, that makes the savings, that puts the savings back to the insurance companies. And from there, they can then offer these zero premium plans. And trust me, it goes deeper than that. But that's
Yeah.
kind of it in a nutshell.
Okay. Yeah, thanks. I wouldn't want you to go any deeper than that.
Yeah.
It sounds really, really detailed and complex. But
And one thing, John, and in my experience, and I hope you got 2 seconds, I can explain this. In my experience, everyone says, "Oh, you darn insurance companies make so much money."
right,
Oh,
right.
and here's the whole thing. Because we're in New York State, so New York State, Texas, Florida, California, they're the larger states, so they get more of a reimbursement from Medicare, okay,
Okay.
to offer these plans.
Mhm.
So we'll say, and I don't know these figures, but we'll say, just for the sake of me doing the math in my head, for every member that a private insurer enrolls in a Medicare Advantage plan, Medicare pays that insurer, we'll say $800 a month per member.
Mhm.
So 800 times 12, that's $9,600 a year. Medicare is paying an insurance company, will say, for your care.
Mhm.
If you have a major illness, open heart surgery that costs $100,000, that company has to pay that $100,000 out. So right now, that $9,600 that Medicare is giving them for you really doesn't go far.
Yeah, sure. Sure. Okay.
You know, you
Thanks.
gotta have,
Good.
it's a pool of people, the medical loss ratio. So, but I understand the confusion and the bewilderment as how can they offer premium plans and still make money? But that's what
Mhm.
actuaries are for.
Right. Okay. Good. Good. Thank you for that. Next point, you touched on this a minute or two ago, uh, that it sounds like one of the disadvantages of Part C or the Medicare Advantage policies is this requirement of staying within network. So can you, again, expand on that a little bit? What does that mean? Do I need to be concerned with staying in network if I have my favorite doctor? Is there a place I can go to check that out if they're within network?
Yeah, absolutely. So to a point, that's true. That you have to stay within your network of doctors. So there are two types of, well, I shouldn't say, there are several types of plans. There's an HMO, which is a health maintenance organization
Mm,
that has a network of doctors, and you have to stay within that network.
right.
And if
Okay.
you want to go see a doctor in Texas, you have to get prior approval um,
Hmm.
for you to travel down to Texas to go see a doctor. There's another type of plan. It's called a PPO, which is called, it stands for Preferred Provider Organization. That type of plan offers both in-network and out-of-network benefits. So if you stay in network, you're going to pay a lower copay. If you decide that you want to go see that doctor in Texas and he's out of network, you're now going to pay a higher amount for them to go see them. But you do have the option with that PPO plan to go to doctors
Mm,
outside the network. Again, back to our original question, as long as they accept Medicare.
right. Okay. All right. Good. That
Now,
thank yeah.
to elaborate on that even just a little bit further, John,
Sure.
even with the HMO and the PPOs, there is worldwide coverage for emergency and urgent care. So
Mhm.
snowbirds, they can have an HMO and they want to go to Florida for 6 months and they're in Disney World and they trip over Mickey Mouse and break their leg.
All right.
They're covered,
Okay.
no problem. The problem is with the HMO down there is that they can't establish themselves, say, with the cardiologist.
Mm-hmm.
So anyone, so that fallacy of, oh my God, I can't go anywhere. That's not
Yeah.
true with the
Okay.
Medicare Advantage plans.
All right. Good to know. Good to know. Thanks for shedding light on that. Again, a personal experience with what you just spoke about. So at the time, I won't name the insurance company. It was a local area insurance company, and I was seeking guidance on some paralysis I had in my face after my surgery many years ago, and I came to find out, again, this is going back early 2000s. The internet was just in its infancy, and we didn't have all the resources that we had today. So I shopped around and I found a specialist who who specializes in, it's called facial reanimation. It's basically getting the nerves to relearn what they had forgotten or were taken away from the surgical procedure. And this person was based in Wisconsin. She worked out of the University of Wisconsin, again, a specialist in the area. So again, just not listening to a podcast like this back then, I naively just got on a jet and flew out there and thinking that, well, my insurance company is going to pay for this. Well, that was a rude awakening that not they turned me down because they at the time their argument was that I could have sought those same services within network okay, somewhere around this area, which quite honestly, that's so specialized. The Albany area just doesn't have that kind of. So I naively did what I did, ended up paying quite handsomely for her services. They did help, and I have no regrets, but I went to an arbitration hearing with the insurance company to plead my case. They ruled against me. So that was a very expensive lesson learned about that whole in-network, out-of-network, ask questions, right, of your provider before you even think of doing something like that.
Absolutely. And I am a true believer. And again, this is just, again, Chris Amorosi's point of view. I am a true believer that somebody somewhere builds a better mousetrap.
Mm-hmm.
I want to have access if I need it. So I'm always a proponent of a PPO plan. But I got to tell you, John, you know, there are, you know, I deal with 5 companies, and I'm not going to mention them, but 3 of
Too
them.
late. I already did.
Oh, okay.
The
So
intro, yeah.
three out of the 5
You're good.
companies that I'm contracted with have national networks. So what that means is you can go to a doctor in California, and if they are in that plan's network, doesn't have to be in New York. If they are just participating in that plan,
Okay.
it's like going to Ellis Hospital, or and
Yeah.
so it's important. And there's 3. I've done this for 30 years, and I boil it down to 3 P's: price, provider, plan. You could have a good product, you could have my provider, but the price is out of sight, not good. You can have a good price, you can have a great plan, but my provider's not in the network. So you want to get that tripod of those 3 P's when you're shopping. That's what you want to look for.
Okay. That's a good way to remember that. Very good. Thank you. Thank you. Let's move on to the third mistake in his eyes that is being made out there. And that is choosing traditional Medicare. Again, back to traditional Medicare, choosing traditional Medicare without supplemental insurance, or Medigap, another name for it, coverage. So he mentions that there are 10 different types of plans under Medicare supplemental insurance, or this Medigap insurance. That's quite honestly confusing, Chris. I mean, that's a lot to absorb for the average person who's under stress trying to make these decisions. So that complexity, can you break it down a little bit better for us, easier to understand for us lay folks?
Yeah, there are numerous plans out there, and I mean, there's Aetna, Anthem, Cigna, Humana, Mutual of Omaha, United Healthcare, just to name a few, that offer Medicare supplement plans. So just quickly, what a Medicare supplement plan is, just what it says, it supplements Medicare. Medicare only pays 80%. So, and then we talked about that $1,600 inpatient Part A deductible, and then you have a Part B deductible of $226. These Medicare supplement plans pick up those deductibles for you, and they pick up that 20% that Medicare, traditional Medicare, doesn't. So all of those plans, insurance companies that I offered, and there's quite a few more that offer the Medicare supplement plan. So there are 10 plans: A, B, C, D, F, G, K, L, M, N.
Okay, that's an alphabet soup there.
Yep. Yeah. They're each coded. Each coded letter plan offers a different level of benefits. So as you can see, A is the least coverage. Really, the best 3 popular plan, I shouldn't say best, the 3 most popular plans out there right now are F, G, and N. More costly because they offer greater coverage. And again, in my opinion, there's a time when MedSup is a good choice. You know, if you're healthy, you have minimal doctor visits, minimal procedures, minimal prescriptions, there is no need to spend the amount of money that the Medicare supplement plans cost nowadays. That's an option. And perfect example, my aunt, she is 89 years old, and I put her on a local plan. She loved it. She had just A and B, never had nothing else, because her husband brainwashed her and saying health insurance
Okay.
is no good. So unfortunately, my uncle passed away. Then I talked to my aunt, and we got her enrolled in an HMO. She loved it. And unfortunately, she started to have infusion therapy, which carries a 20% copay on the Medicare Advantage plan. So she was getting bills for $800-900.
Yeah.
So she called me up, and I said, Aunt Bev, I think it's time we look into a med sup plan. So we put her in plan N, took care of all of those charges for her. She did pay a little bit more, but what she's paying in premium is offsetting what she would have had to pay if she was on a Medicare Advantage plan. So just because you start out with a Medicare Advantage plan, you're allowed to change every year. And if your health unfortunately takes a bad turn for the worse, you can switch to one of these Medicare supplement plans. So I'm always, that's one of the benefits of having an agent sit with you, because they will help you find out where you need to be at this time. And then if things change, they can help you make that transition to a different plan.
Sure. And this is the time of year to do it, right, Chris? Isn't
yeah, matter of fact, it opened up, open enrollment opened up yesterday, and it goes to December 7th.
Yeah, this is the time to make those changes. Okay. Good. So that answers that concern. Again, I don't mean to inundate folks with personal stories, but so just to the opposite of what you did with your aunt, sounds completely appropriate. I took the other tack with my mom. As I mentioned before, her health issues. I knew there was some pretty catastrophic bills coming down the road. So I did my, the research I knew how to do at the time, and I ended up going with a Medigap policy. And I don't mind mentioning the company. It was United Healthcare. It was through AARP, which I think is super popular. And she paid at the time, she was paying her, I think she was on the F plan, which was, I think at the time, kind of like the Cadillac of plans, so to speak. And she was paying, again, at the time, probably her $269 a month premium. Chris, she had hundreds of thousands of dollars of medical bills that were covered. I mean, she had knee replacements, 2 of them. She had all the chemo, the cancer treatments, and all she ever paid was that $269 a month, no questions asked. So again, to summarize the last point here, again, if you could just summarize, when again should somebody be leaning towards Part C, the Advantage plans, and when should they be leaning more towards a Medigap policy?
Yep, and I just to go back real quick, with the Medicare Advantage or with the Medicare supplement plans, because it doesn't have a Part D component attached to it, you have to also get what's called a standalone prescription drug plan to go along with that Medicare supplement plan. And also the individual plans that all these companies offer, all offer the same coverage, no matter the insurer, but different insurers will charge a different amount for the plan. So again, you have to shop around as well for those. But to your question, John, and when it's a comfort level. Are you okay with copays? Are you okay knowing that if you go into the hospital, this is what I'm going to pay? Or if I go to a doctor's office, this is what I have to pay. Where is your health at this time? Are you a healthy person? Like I said, you can always switch to a med sup. New York State, which is nice. New York State is what's called a guaranteed issue state. So there's no waiting periods. And then cost. Plan G is around $245 a month. Then you're going to have to get a standalone Part D, which is going to run anywhere between $60 and $90 a month. So you're looking at $335 a month, which comes to about $4,000 a year, not counting your deductibles for your prescription drug plan. So you have to take that into consideration. And I always tell folks, peace of mind, whatever cost that you have to pay for your health care, if it gives you a peace of mind, then that's the best plan for you.
Right. Okay. Okay, good. Yeah, clearly there's not a one size fits all when it comes to those two different choices. Okay.
Correct.
The fourth mistake that he quotes, and again, you alluded to it a minute ago, folks forgetting or not even knowing that they had to sign up for prescription drug coverage, or that Part D that you referenced in the past. So regarding Part D, it sounds like that's not something that folks are automatically enrolled in, right? You've got to be proactive in seeking that and claiming that, so to speak. And if you're not proactive, there's some pretty strict time frames. It could hurt in the long run if you're not proactive with that.
Correct.
Yeah.
Correct. So the magic number is 63 days. So
Okay.
if you are just turning 65, you have 63 days. Let me take that back. You have really 7 months, 3 months prior to turning age 65, month that you turn 65, and 3 months after you turn 65. So you have a 7-month window to get everything in place. And that includes your, Part B, Part D, and enroll for a plan. If you're losing group coverage, then there's a 63-day window to get enrolled in any other health coverage along with a Part D. If not, then there is a 1% penalty for each month that you are not enrolled in a Part D.
For each month.
Each month.
Okay.
Okay. Now, it's again, not to, it comes to about maybe 32 cents, but I enrolled an individual in July, found out that she did not have a Part D plan, I think for, I don't know, it came to, I don't know. Anyways, when we figured it out, it came to, she had a $45 a month penalty. So if the premium is $10, you're automatically going to have that $45 added onto it every month for the rest of your life. So
rest of their life. Wow.
rest of
Okay.
your life. Yep. And then here's the other nice thing that people need to be aware of is that there is that income, the IRMA.
The IRMA, yeah.
For Part
monthly
D as well.
adjustment. Yeah.
Yep. So now not only do you have it for Part B, and boy, you got it for Part D along with the penalty.
Right.
So
right.
I appreciate people trying to navigate this all by themselves, but somewhere someone's going to forget to do something.
Sure. Yeah. It's complex, to say the least. Okay. So sign up for that Part D. Just don't assume that it's going to be there when you're looking for it. Chris, as far as the drugs themselves, is there a place that folks can go to research that, they have to take a blood pressure medicine every month? Is there a place to go to see if that is covered?
Yeah, whatever plan they're interested in, if you go right to their website, you can look on their formulary.
Formulary, that's the term that I was thinking.
The term, okay. Yep. So every company has a formulary. All companies have the formularies broken down into tiers. Tier 1 is your generics. Tier 2 are your preferred generics. Tier 3 are, preferred brand. You have tier 4s, tier 5s. Some only have 4 tiers. Majority of the plans nowadays have a 5-tier prescription plan coverage with their formulary. What I like to do when I sit down with my clients, even before I meet with them, I ask them to give me their doctors, their hospitals, their prescriptions,
Mhm.
their pharmacy. Um, Before I even meet, then what I do is I go through all the plans, see what plan is. I want to make sure that all their drugs are covered. I want to make sure all their doctors are covered. I want to make sure that their pharmacy is in network. Once I have all that information, then I set up an appointment with them. We sit down and I give them my recommendation. And ultimately, I tell them plan you'd like to go with.
Okay. Makes sense. Makes sense for sure. Uh, the last area, mistake number 5 in the author's eyes. And this is going to hit home directly, Chris. So it's, and again, honest and open feedback. So that's what we're looking for. And he states that many people just go on blind faith and they don't really check out their broker or the consultant that's helping them walk through this myriad of choices. So give us again a little inside baseball here about that, and take exception if you want to. That's perfectly fine. But again, at the end of the day, it really comes down to, there in my field, there are ethical, moral financial advisors, and they're not so ethical and moral financial planner. And every profession has that. So give us an understanding of what we should look out for.
Yeah. Well, first thing, the author is correct to a point. There are some ethical people out there. And I've come across some ethical people who are in it just for, their pocket. They change members every year. They get always looking to switch to get more money, this and that. And so what you want to do is you want to get referrals from friends, from family, senior organizations, from your financial advisor. Once, I mean, we do that, I think we all, hey, do you know a good doctor? Who's a good orthopedic? You just don't go blindly to a doctor. You ask friends and family who they maybe had a knee replacement with. So you should do that with a licensed insurance agent. There's a lot of information out there, and we just scratched the surface on all of this stuff today. So can someone do it on their own? Absolutely. But if something is overlooked, it can cost them. So you want someone that you can trust, someone that will work with you, work for you. What's nice with having a broker is if we enroll you, or if I enroll you into, we'll say, Acme Company, and a claim gets denied, you, the client, don't have to call Acme Insurance Company. You call me. I will deal with the insurance company for you. So I can take a little bit of that stress or that headache off of your plate, and I'll worry about all that stuff. If you have a question, you call me. You don't have to go on the internet and read 3 different articles that have 3 different, information. So
that's big. It's big.
Right. And that's, to me, that's the benefit of having a local licensed agent, is that they are your advocate. And just to pat myself on the back a little bit, because I've been in the business for so long, all of the companies that I'm contracted with, I have such a good reputation with the Medicare broker managers that I have them on speed dial, and it's so easy because they'll pick up, because they know who I am. So they'll pick up the phone, and I can get answers quickly. So just do your homework, please. And please, whoever's listening to this, if you get a phone call from those TV commercials that I can give you, a brand new Cadillac if you sign up today, please do not enroll with them. Please. because there is somebody that is sitting in middle America in a room full of operators, and they just keep hitting the button, and then that next phone number that comes up, once they enroll you, they're not going to know who you are.
Yeah. Yeah, of course. Of course. Yeah, I can think of the former great football star who comes on without fail this time of year, touting a certain plan for Medicare purposes. So completely agree with you, Chris. And I think of not only the elderly person or the person, I mean, elderly for crying out loud, 65, who's thinking of enrolling in this. Yeah, yeah, I'm not too far from there. I could imagine.
I'm knocking on the door, John.
All right. I retract that last statement. But folks who are trying to navigate, who they're ready to dive into this, and then maybe their kids who are trying to do this on their behalf too. That so-called sandwich generation, I guess. They may have younger kids and they have older parents that they're stuck in the middle.
Yep.
And I remember this when my mom was going through it and the decisions I had to make. I mean, my kids were, I don't know, 3 and 5 at the time, and it was a tough time period for sure. So if there was somebody out there that I had trusted, had a relationship, was a stellar referral network, and just trusted them, in a heartbeat, I would have consulted and happily paid for that service. So good to know. Good to know. All this is fantastic. We're bumping up on here on about 50 minutes or so.
Yeah, and matter of fact, John, I have an appointment this Thursday with a woman. She's in her mid-80s, and her daughter lives in Delaware, and her daughter called me and said, "Can I meet with you? I'm coming into town Thursday. I would like to sit with you and my mom." So to your example, that's the child basically helping the mom out. And I prefer that because it gives me some credibility with the mother, with her daughter saying, "You know what, Mom, this is a good idea. I think we should do this because, you're going to listen to your child."
Right.
So.
Right. Good. Thanks for that. I think we've covered all the points, Chris. Anything in closing? I want to ask you for your contact information in a second, but in closing, anything that we didn't hit on that you think is really important to get out there to people, or do you think we covered a lot of the major topics here?
Yeah, we covered a lot of the major topics. Again, the two things that I would like to take away from this is again, if you plan on doing this on your own, which I hope you don't, just please do your homework. Do not enroll with anyone calling from Medicare over the phone. And I,
Sure.
it's crazy. As you can see, John, there's so much information, and we could have gotten deeper into the weeds with all. I mean,
right.
We didn't touch on, just a lot of the, the donut hole, the coverage gaps, there's just so much more that people need to know.
Right. Right. Folks that are still working but may have claimed Part A, but now they're thinking of claiming Part B or something along those lines. Yeah, yeah,
exactly.
For sure. There's a lot out there. Chris, if people are interested in talking to you, what's your contact information? What's the best way to get a hold of you?
Yep, they can call me at my direct number to my cell is area code 518-416-4810.
Okay.
Just call me. I have my phone with me all the time. I don't know. Do you want me to give an email address or?
Yeah, if that's another method of communication, for sure.
And you can email me at Chris, CHRIS, M as in Mary, ORO, S as in Sam, the number one, not the word, the number one at gmail.com. I would appreciate it. I would love to hear from you. I would love to sit down and help you navigate through these crazy Medicare waters. I really would.
Great. And that phone number again, Chris, was
518 416-4810.
Okay, great. I would suggest another way as well. Sometimes folks are a little timid in perhaps reaching out directly to you. So folks can always contact us here at the Albany Financial Group at the office at 518-786-3300. And if you're interested in talking to Chris a little bit more, just send us in a note, give us a call, and we can certainly arrange that.
And John, just one last thing. I'm sorry.
Sure. No.
But no, and this is this is my my motto for the year. You know, every year we all go for a physical to our doctors. So every year you should do your health insurance review, because what you purchased or what you enrolled in last year may not be working for you this year. And it's not necessarily to change, just to sit down with you and make sure that what you have in place is still what is working for you. So, but just a health insurance checkup. That's all.
Sure. Yeah, that's a great point. I think sometimes folks think that, well, I'm in the Medicare system. It's a done deal. It's all set, and I don't have to worry about it for the rest of my life. And that could not be further from the truth, quite honestly.
And again, my services are no cost.
Yeah. Good to know. Chris, I can't thank you enough for your time today. It really, this is going to resonate with a lot of people. I know it. Again, to have a local, that's critical too. Having a local representative, not at an 800 number. They pick up the phone, they get you, right? They call that number, they get you.
Yes.
So again, in my book, that's huge. So again, thanks for taking the time today to share some of your knowledge with us.
Oh, John, I truly appreciate it. And I hope I didn't muddy the waters even more than they are. I hope I cleared up a couple concerns for some folks out there.
You certainly did. You certainly helped a lot of people there, Chris. Thanks so much.
Thank you.
And that's the end of this episode of our podcast. So I want to thank everybody for tuning in today. And please stay tuned for the next episode of Invest in Knowledge. Thanks and have a great day. The concepts and some of the facts in this podcast episode were derived from a Wall Street Journal article dated August 15th, 2023, written by Amitabh Chandra. John Gigliello is a registered representative with, and securities are offered through LPL Financial, member FINRA, SIPC. Investment advice is offered through Private Advisor Group, a registered investment advisor. Chris Amorosi is not affiliated with LPL Financial, Private Advisor Group, or Albany Financial Group. Private Advisor Group and Albany Financial Group are separate entities from LPL Financial. The opinions voiced in this material are for general information only and are not intended to provide specific advice or recommendations for any individual. All performance referenced is historical and is no guarantee of future results. All indices are unmanaged and may not be invested into directly. The economic forecasts set forth in this material may not develop as predicted, and there can be no guarantee that strategies promoted will be successful. This is a hypothetical example and is not representative of any specific situation. Your results will vary. The hypothetical rates of return used do not reflect the deduction of fees and charges inherent to investing. Individual tax and legal matters should be discussed with your tax or legal professional. Thank you and have a nice day.